tomorrow. From the latest breakthrough in green technology to the discovery of humanity's oldest tools, you'll find it all on the Academic Minute.
Listen every weekday afternoon during the KSJE Evening News at 5:30. KSJE is supported by San Juan Regional Medical Center, which is officially baby-friendly. This evidence-based initiative is designed to support mother-baby bonding and optimal infant feeding practices by upholding the 10 steps to successful breastfeeding. San Juan Regional Medical Center, officially baby-friendly, and serving the Four Corners since 1910. Find out more online at sanjuanregional.com. 9 minutes past 8 o'clock. It is Wednesday morning, November the 6th. Good morning, everyone. I'm Scott Micklin, and thank you for tuning in to KSJE 90.9 FM over the air in San Juan County, 103.3 FM now over the air in Durango, Colorado, and everywhere streaming this morning on our website at ksje.com. Special good morning also to our viewers who are taking advantage of our visual radio technology by joining us live on the KSJE YouTube channel and our Facebook page. Welcome aboard, everyone. We are glad that you are with us. Thanks so much for joining me this morning, everyone. We've got a busy morning to get to, and I want to start off by giving you an update on the elections that were held yesterday here in San Juan County. And again, we were following the contested races here on KSJE, and those results are on our website, ksje.com, but I can share a couple of those with you right now. In the Central Consolidated School District, winners in District 2, Gary Montoya, District 3, Charlie Jones, and District 5 is Husky is the winner in that race. And then moving along to the San Juan College Board races in District 6, Shane Chance returns to the San Juan College Board of Trustees, and in District 7, Valerie Usselman will join him on the board. That was a tight race in District 7, however, just about 19 votes between Valerie Usselman and Peter Deswood, the third in that race. Several close races, as a matter of fact. Farmington Schools, Kyle Rhodes is going back to the Farmington School Board, but again, only about 36 votes separated him from his challenger, Andrea Turman, and Joan Valle is going to the Farmington School Board, and again, she was ahead of Rick Quevedo, but only by less than 30 votes or so last night. Over in Aztec Schools, Paul Bandy will go to the Aztec School Board with his win last night, and Roger Collins has 234 votes in District 5. The mill levy that a lot of folks were watching for Aztec Schools did pass, 1,113 votes for it, 762 votes against it in the Aztec School District. In the Bloomfield School District, the mill levy also passed there with 4 votes of 798. For and against was 525 in Bloomfield Schools. And the last contested race we were covering last night in San Juan County, the San Juan Soil and Water Conservation Board, the at-large position 5, Catherine Thomas Kemp comes away the winner in that race with more than 3,700 votes. So coming up this morning here on KSJE, we're going to talk healthcare with my guest, Jeff Bourgeois, the CEO of San Juan Regional Medical Center. That you'll hear in the next few moments right here on KSJE. And then later on this hour, we'll get our weekly dose of encouragement from Dr. Mike Hadabaugh in the Encouragement Lab this morning. Dr. Hadabaugh is telling us all about pain management. That's coming up later on this hour, 8:50 a.m. on KSJE. Mick Hess will be here roving with the arts after the news at 9 a.m. Mick is playing Symphony 11 from the great Shostakovich coming up on Roving with the Arts today. And then, of course, it's our local and regional author program right on Four Corners. Author Rena St. Clair is speaking with Tracy Hales-Vass today about her book called Getting New Mexico. And you'll hear that interview coming up this morning at 10:30 a.m. on KSJE. Don't forget, of course, to connect with us on social media. You can like our Facebook page, subscribe to our YouTube channel, follow us on Twitter, of course, and check us out on Instagram as well. We always say, of course, that visual radio can take you places. This morning, why don't we take you to the Atlantic coast, off the coast of New Jersey, Manasquan, New Jersey, courtesy of EarthCam as the sun rises over the East Coast, and currently temperature in Manasquan, New Jersey, 51 degrees this morning on its way to a high of 55. and a low of 39 with sunshine in Manasquan, New Jersey today. Here at home, we're expecting some partly cloudy skies today with some very isolated showers and maybe even a thunderstorm in the forecast. And the showers this morning could have some snow mixed in. A frozen mix in the forecast today with a high of 65, 32 with isolated rain showers continuing tonight. Sunshine returns tomorrow with a high of 61, 59 and sunny on Friday, 61 on Saturday, and 62 on Sunday with overnight lows in the mid to upper 20s. Joining me this morning in our visual radio studios to talk a little bit about San Juan Regional Medical Center, the CEO of the hospital, Jeff Bourgeois, is here. Mr. Bourgeois, welcome back to KSJE.
Thank you, Scott. It's great to be here.
Thank you for coming in to talk a little bit about the hospital and what's been going on. And I know there's a lot of new providers that are coming or are already here that we'll talk about, and some other things that are happening. I want to ask you first of all a little bit about finances and budgets. And of course, healthcare, as we know, is a complicated animal in this country. And so how are things these days at the hospital? We had some layoffs over the summer, and how are things today?
Well, Scott, they're actually going very well. But before I answer that question, I want to take the opportunity to say thank you for all you and your station do to support Farmington and San Juan Regional Medical Center. I see you all over town in any number of roles, and your level of community involvement is to be commended. So I just want to take the opportunity to say thank you for all that.
Well, I appreciate you saying that, and that's why we're here as a community radio station. So this is what we do, is get folks out to the community and talk to the audience. So it's a two-way street, I should say. So anyways, it's good to have you here, and thank you for those kind words.
You bet. So back to the hospital's finances.
Right.
We had a rough year on our fiscal year ended June 30. We had to make some very large one-time adjustments to our contractual allowance model, which basically is the estimate of how much money we don't expect to collect based on what we charge, and that's due to continued downturns in reimbursement, particularly from some supplemental payment programs that the state have. We believe we've made the changes we need to make, and we are excited about our future, looking for some opportunities for growth and new services, and I think we're going to talk about that here in a little bit as well.
Okay. But these are mostly state issues that I guess cause some of these problems, budgetary problems for the hospital, not federal problems?
Well, it was at the state level where the big reimbursement cuts were, yes, Scott.
I see.
And it was really incredible to watch our organization try to absorb that over the first 3 years I was here. But that has leveled off now, and with the new revenue that's coming into the state from the success of the oil and gas industry in the southeast part of the state has a fair amount of new money, and they are making a conscious effort to try to increase Medicaid reimbursement, since 46% of our state's residents are now on Medicaid, to make sure there's adequate reimbursement in the provision of healthcare services, both for physicians, hospitals, and other healthcare providers, to encourage healthcare providers to take Medicaid patients as part of their services. So I will commend the state for the work they've done recently on that.
Got you. There's some things that we as constituents should be watching for from Santa Fe at the next legislative sessions. Are there some things that are being introduced that you'll be keeping an eye on?
There are, and they're actually, the financial models for those are being built right now.
Okay. A little early to talk about it then?
Right, because it's just too premature, but it is along the same lines of increased Medicaid reimbursements for hospitals.
Got you. And I know San Juan Regional Medical Center is somewhat unique. It is a nonprofit hospital, and it serves this wide area, and it has a lot of expertise. And I forget which level trauma center that you are, but I know it's one of very few in the state. And so there's a lot of responsibility that comes with this hospital and the services that it provides to the community here.
You're exactly right, Scott. With our relatively isolated geographic location, our trauma center serves a wide geographic territory. Both we're including New Mexico and the surrounding areas of the Four Corners. We're the second busiest trauma service in the entire state. We're a level 3, but we provide neurosurgical coverage, general surgery coverage, and orthopedic coverage, all which are very important to help treat and attend to the needs of the seriously injured trauma patient in that first few hours of their need. And without that service here, many patients would have to be transported to Albuquerque, Denver, or Phoenix as the next nearest trauma center, depending on which center can accept a patient at any given time. And also during the winter months, sometimes weather plays into accessibility trauma services. So kudos to our trauma services and our air ambulance team. We are blessed with an abundance of very talented caregivers here in Farmington, and they do an outstanding job to help meet community needs.
Right, that's true. And you mentioned some of the other things that I know you've been building over the last few years. I know cardiology certainly is worth mentioning. You talked a little bit about some other things too, some of the neurosurgery,
right,
if I'm not mistaken, and things like that. We always hear that healthcare could be an economic driver in a community, and as Farmington and San Juan County looks to diversify its economy, I think a lot of eyes are looking at you and the hospital as maybe a way to do that too.
Yeah, if you were to take collectively all the healthcare jobs in our community, I'm certain we're second only to the oil and gas industry jobs in the county. As an individual employer, we're one of the top two in terms of number of employed individuals. But you're right. We now have 3 interventional cardiologists here in Farmington on our medical staff. We have 2 full-time neurosurgeons, including the only fellowship-trained, minimally invasive neurosurgical spine surgeon in the entire Four Corners region. We got a verbal commitment last week from a 3rd neurosurgeon, and we've been blessed with a host of other new providers that we can touch on in a second. But we're also working on expanding our footprint, and we now have a specialty services clinic in Durango, up off of Florida Road, where we have cardiology, neurosurgery, and urology physicians who see patients at that location.
And that is by design to try to reach out to that part of the region as well?
It certainly is. We had a clinic in Bayfield, and we were able to move it into Durango, into a newer location up on the north end of town, off of Florida Road, as I mentioned. And additionally, most of those same providers also hold some visiting clinic hours in Cortez in conjunction with Southwest Memorial Hospital there. We have a nice relationship with them to help their patients stay local for the needs that they have, but if they need a higher level of care, then we work with the hospital to get them to Farmington.
And that is a big thing with healthcare these days, right, is to figure out what the needs are in a community, maybe what you can specialize in, and then, of course, it's not cheap to get these folks in to provide these services, right, and to recruit them or find them at home to do all those things, right?
That's exactly right. It's a big investment the hospital makes to help recruit new physicians, both employed and private practice physicians. We work with private clinics in town if they have a need to help with their recruitment needs. And if not for that, the physician coverage and also what we call allied health professionals, nurse practitioners, midwives, physician assistants, are also they are now playing an increasingly important role in the delivery of health care across our country, as they help the physicians practice at the top of their license, and these allied health professionals can serve as a great extension of a physician to provide access to care for a wide range of patients.
And we sometimes hear that there are shortages in some of these specialties across not just New Mexico, but across the country. Is that what you find as well when you're in recruitment mode?
Oh, yes. The demand for healthcare services is tremendous as the baby boomer population ages. There are 10,000 people in our country every day turning age 65, and that'll happen for the next 5 to 6 years. And what happens when we all get older? We need more health care. So the demand for health care services is not only driven by the increase in population in our country, but particularly the aging baby boomers and their need for access to health care. So it's a very competitive environment to recruit within, and we've been blessed with our recruitment success, particularly here of late.
Right, and we'll talk a little bit about some of these folks who are going to be joining your team in just a moment, but I know it's very competitive to try to find these qualified people to come to these places, and you can't just throw bags of money at them, I suppose, but there are other things, too, that you try to do, right, to get them here.
Well, we do, and we offer for those getting out of school assistance to either help with their finishing their education or some loan repayment. But what we found is once we get physicians and other providers to Farmington so they can see firsthand what our community has to offer, they're often pleasantly surprised if they haven't researched it in advance. And just met this morning with a young family medicine physician in training up in Nebraska, and he had researched our community well. And it has what he and his wife and 3 young children want in a community. They're so impressed with our library, the quality of the school systems, the sense of community we have here. The strong faith community happened to be important to this young family, and it was rewarding to see his interest in us. And we think we're going to find a good fit with this young physician in the years to come.
Very good. Well, I want to ask you a little bit about some of these other new folks who are coming. You mentioned you have a verbal commitment from this guy. Get him to sign the paper.
Okay.
Get him to sign.
Yes, sir.
Lock him in. But who else is coming? There's some things that we want to certainly celebrate about your staff and your volunteers.
Yeah, Nancy Brooker is a nurse practitioner who had left us a couple of years ago to move to Colorado. She's now back working in the San Juan Health Partners Internal Medicine Clinic. Dr. Robert Burr is a new endocrinologist to our community. He's here, boots on the ground, seeing patients. Clay Church is another clinical nurse practitioner in cardiology. Dr. Matthew DeFrancesca in emergency medicine. Dr. Raul Gokru is an interventional cardiologist right out of training. Very pleasant young man. Amanda Jernigan, another CRNA, which is a registered nurse anesthetist.
Okay.
Dr. Linga, pediatrician, has joined our pediatric clinic. Dr. David Rushworth, a new neurologist, joined our community this year. Dr. Scott, anesthesiologist. Erin Tucker, another nurse practitioner for family medicine. Dr. Joshua Turner, a hospitalist.
It's quite a list you've got there.
Russell Watson, another CRNA, and Kelsey Wolf, another family nurse practitioner, and a nurse practitioner for our heart center. And we had also Dr. Stephen Bernard, another interventional cardiologist, join us way back in September. It seems a long time ago. And we have a dozen or so more signed commitments, not verbal signed commitments from hospitalists and other physicians who will join us next summer and beyond as they are able to finish their training.
Very good. And a lot of folks may think, well, that's where you're really working in advance, but that's kind of how you have to do it, isn't it? To kind of identify these folks and maybe get them to commit and sign even a year out. It's not unheard of in your industry.
It is. It's competitive. They need to know where they're going to go and have a plan to be able to finish their education. And oftentimes some of them will tailor their final year or months of training based on where they're headed, because the practice opportunities differ a little bit from location to location.
Sure. And of course, we hear a lot about student loans, and I know for a lot of these budding doctors and nurse practitioners and others, it's not cheap to go to medical school, and sometimes they're graduating with a lot of student loan debt. And you mentioned that one of the benefits may be some help with loan repayment. That's part of your perks, is it not?
Yeah, that's one of the components we can put into a recruitment package for physicians, by all means.
Gotcha.
We have to, and we're happy to do so, but we feel we have to oftentimes to be competitive out in the market that we.
Sure. But in exchange, too, you expect them to be here for a few years, right,
Yep.
in order to get that benefit.
There's
Usually.
a practice commitment that comes along with that loan forgiveness, you bet.
Gotcha. Well, again, congratulations, and it sounds like a lot of great new talent coming to the area, and that's important. And all this, again, as we hear from the national level, there's talk about changes to health care and things like that, and I know you probably can't get too worked up over that until something actually hits the president's desk or Congress or whatever, but there's a lot of competing things going on, and you and your staff just have to keep providing service to the community, right, no matter what happens.
Right. From an administrative point of view, we get used to operating in a world of ambiguity because
the what ifs and who knows, and
this may or may not be on the horizon. You better get ready for it, but
maybe not.
Yeah. So you're exactly right. So it keeps our jobs interesting at the administrative level, but also what we want to do is focus on our caregivers who are at the bedside and those that support our caregivers. We like to think of them also as caregivers. We're all on working for the same organization with the same ultimate goal of providing excellent quality and service to those we are so privileged to have the opportunity to work with.
Sure. Jeff Bourgeois is my guest this morning. He is the CEO of San Juan Regional Medical Center. We are talking about some of the new staff and additions to the hospital's staff and some other things coming up. You have a volunteer, I know, who has gotten some statewide recognition, correct?
We have. In fact, we've been blessed with a number of recognitions. If I could just take a few seconds,
Yes.
Scott. Earlier this year, our EMS service received a Mission Lifeline Gold Plus Award from the American Heart Association. We were the only EMS service in the state to receive any level of Mission Lifeline recognition, and we received the highest level.
Okay.
It deals with meeting all the required elements for pre-hospital care for the heart attack patient, so that we can have proper diagnosis made in the field while we are transporting the patient back to the hospital. So our emergency department teams, our cath lab teams are well aware of what is coming via ambulance and are ready to provide interventions immediately when the patients arrive. So kudos to the EMS service and the great work they've done.
I remember talking to your cardiologist, and they remind me all the time, time equals muscle when you're having a heart attack, right? So the quicker they can get treatment, the faster they can help save some of the heart muscle from deteriorating any further.
Absolutely. You could do my job, Scott.
No, I can't. Oh, I certainly could not. That is for sure.
I also want to recognize we have a physical therapist, Todd Thomas, who is recognized as the Outstanding Physical Therapist of the Year in the entire state of New Mexico. And then what you mentioned, Scott, was
A volunteer.
Yes. And Zane Chapman,
Yep.
who's a teen volunteer, senior at Aztec High School, was recognized as a Teen Volunteer of the Year, again in the entire state of New Mexico. Zane's an outstanding young man. When I was able to read some of his accomplishments at the recognition ceremony actually in September, at our State Hospital Association conference, it was impressive, from an outstanding GPA to all sorts of extracurricular activities, including his volunteer work at the hospital. Zane wants to go on and serve either in the Naval Academy or with the Coast Guard, and he's seeking appointment in one of those avenues. So congratulations to Zane, and his very proud parents include his father, Terry, who's the manager of our cardiology unit and cath labs there at the hospital as well.
Very good. Well, congratulations. And I know you have a lot of very dedicated volunteers that help throughout the hospital. It's always great to be able to visit with Teresa Becker about all the things that the volunteers do and provide. So there's one great example.
Yeah, in addition, they've, speaking of the volunteers,
Yes.
They typically provide us some money every year to buy needed capital equipment for the hospital, and this year they've increased that by another $100,000. So Sue Carlin is doing a great job leading that organization this year. We're so blessed to have an active and engaged group of volunteers serving San Juan Regional Medical Center.
Indeed. Well, and again, having those volunteers saves you from having to pay staff to do some of the things that they do for you.
Well,
So,
it does,
I'm sure that
but
helps.
more importantly, it creates a tighter tie to the community, and that's important. We are a community hospital, nonprofit, locally controlled, independent, and that's our intent to stay that way. And this is just one of those features that really helps us stay connected to the community, to have such a great group of volunteers.
Right. And when you talk about that, I know there's a lot of input, too, from the community on your corporation board. Isn't that true?
It is.
That's the right term to use, right?
Yep,
Okay.
Yep, and we actually had our last quarterly meeting this past Wednesday night, and we had 70-plus people in attendance, even though it was Game 7 of the World Series.
That's impressive.
We were pleased to see that number of people turn out, and we shared with them some details around what I've shared with you here today, where we're going in the future, our new services, the new providers coming in, and we actually had Stephen Malarchik from the EMS come and talk about that Mission Lifeline
Nice.
Gold Plus Award.
Very good. And I know there's a lot of talk about affordable health care in this country. And again, this is another maybe national topic, but I imagine it's stuff that the hospital tries to keep in mind as well. I mean, when someone comes and they're not feeling well, or they show up in the emergency department or what have you, you treat them. You can't turn them away. And so whatever it costs, right?
That's correct.
And you guys have to figure out how to pay for it later.
Right. As a 501c3 nonprofit tax-exempt organization, we have obligations to provide care to those without resources as well. So we have a robust tiered care program, and if patients meet the criteria for that, then we provide that care without reimbursement. The balance is for those patients that do have some sort of coverage, whether it be Medicare, Medicaid, commercial insurance, that we also have a very efficient process in place to bill and collect the funds that we are entitled to receive.
Sure. And again, that's always maybe evolving, changing. You have to keep your eye on what's going on in that world, I know. So it's an ongoing conversation, I'm sure.
Right.
With some of those folks. A couple of things that are going on. You've got the flu shot clinics, I know. It is flu season. We had an early start. Dr. Singleton was here not too long ago to tell me a little bit about the flu season, and things were starting a little early, I think, than what maybe we're used to. But it comes every year, and so there's a few more free flu shot clinics that the hospital's offering to local residents, correct?
That's right, Scott. We already have a couple of behind us, but actually on Wednesday, November 6th, today, we'll have
Later on today, yeah.
We'll have a session at Bloomfield Senior Center from 9 a.m. to 11 a.m. It's open to everybody, 18 years of age or over.
Right.
And then on Thursday, November 7th, at the Lower Valley Senior Center in Fruitland, 9 a.m. to 11 a.m. again. And then on Friday, November 8th, the following day, 5 p.m. to 7 p.m. at our San Juan Health Partners Clinic there on South Schwartz Avenue.
Okay.
So
this week, the rest of this week, you've got three clinics, one after the other. Today, tomorrow, and Friday.
We encourage everybody to get your flu shot. We put a big push on at the hospital. We offer free flu shots as well. That's a bit of a tongue twister, isn't it?
Right.
I'm trying to talk as quickly as you, Scott. It doesn't work.
Well, I should slow down, so that's okay.
But we offer a free flu clinic for the family members of our employees as well. We did that last month, and this is our outreach to the community. We consider it important, and it is something that I believe every healthcare provider would encourage any person to pursue, to keep yourself healthy and prevent yourself and others from catching the flu.
Right. And I know this program and maybe some others, Mr. Bourgeois, that the hospital offers are kind of that same line, right, to keep the community healthy. I know there's a lot of support groups that the hospital offers and hosts at its facility at no charge for maybe stroke patients and other folks to come and take part in. Again, all for a healthier community, not that the hospital can make any money off of it, but just to provide these services to the community, correct?
Exactly right, Scott. From our lactation consultants that help new parents keep their newborn children healthy. We have a number of services throughout that, including now Facebook Live for new parents that just started recently. Diabetes education is another example of what we have to offer in terms of helping people stay healthy. And then we also have a cardiac rehab service post a cardiac event that is offered at the hospital as well. So just to touch on a few.
Right. I know there's a lot more, but
Yeah.
that's for sure. And then in our final minutes remaining here, Jeff Bourgeois, I know you're getting some money. You mentioned some reimbursement funds and increases from the state, but the state's also giving you some capital improvement dollars, right, to do some improvements for the hospital.
They are, Scott. We're so excited about that. On the less glamorous side is some really needed work to our chillers and cooling towers and hot water supply system. So thanks to all of our local elected state delegation to funding that, $1.4 million.
But next July, when it's 100 degrees outside, people will appreciate the chillers and coolers at the hospital.
Very much so. So we'll be doing that work in the first quarter of calendar year 20 when it's cooler.
Okay.
And then the governor's office gave us $1.9 million to totally renovate the labor, deliver, and recovery rooms we have at the hospital. They haven't been touched in 20 plus years. So we'll be able to renovate and modernize just the interior finishes, but also add some state-of-the-art clinical care pieces to it. And we're really excited about being able to offer that for new moms and new families.
Very good. And again, it's another one of those services the hospital provides, right? And it's important to be able to stay up to date with some of these things, and the fact that maybe it hasn't been updated in 20 years is significant.
Exactly. And we're excited about being able to do that. As I mentioned, it'll be a nice upgrade for our hospital to be able to offer.
Very good. Jeff Bourgeois, final minutes here. Can I ask you to look into your crystal ball and look at the future of healthcare or the future of San Juan Regional Medical Center? Again, it is seen as a leader in our community of providing all these important services, the trauma services, the emergency services, child delivery services. We could go on and on. What does the future hold?
Well, you've touched on a few. I think a core part of our business, Scott, is always going to be to do those things you think of when you think of a hospital: emergency, trauma, surgery, childbirth services, the inpatient hospital care. But beyond that, we have to think of ourselves as a healthcare system outside of the hospital walls. What can we do to improve community health and help people maintain their health and actually stay out of the hospital. Long term, that's going to be where the government wants to see our financial incentives to be, and we think from a mission point of view, it's also how we want to think of ourselves. What can we do to help keep our community healthy and enjoy a higher quality of life? And that's where I believe healthcare is going.
Okay. Well, we'll be here with you. Thank you very much for coming in. I'm glad you saw me in my workplace rather than I see you at your workplace. No offense.
Oh, it's always a pleasure to be
Your
here,
office
Scott.
is great, but the patient floors I'd rather stay out of unless I'm visiting.
Well, we would love to have you visit, but it's always a pleasure to be here as well. And
Thank
thanks
you.
so much for having me, Scott.
Of course. Jeff Bourgeois, my guest here on KSJE, everybody, and I'll be back with more in just a moment. This program on KSJE is supported by Citizens Trust and Investment Corporation, providing a competent, innovative, and caring team of professionals to serve wealth management, trust administration, employee benefit plans, retirement planning, and estate settlement needs. Find out more about Citizens Trust and Investment Corporation at 505